Thank you, Dr. Mate. Actually, in 2002, when I watched John Q movie, I realized working in emergency is not only dealing with emergency cases and risk, but required a lot of innovation. So I'm sure that Dr. Tamimi today, he's going to present a presentation about emergency department development program, and that really will show us how innovation can work in dealing with risk and emergency. So I would like to ask Dr. Tamimi, who is a consultant pediatric medicine, and he is the associate executive director of medical administration in King Fahd Medical City. Welcome, Dr. Saleh.
Thank you very much, Ahmed. It's really my pleasure to give you a brief idea about a project that we started working on almost 10 months now, called the Emergency Department Development Program, EDP for short. You see, emergency medicine is a relatively new specialty all over the world, but particularly in Saudi Arabia. The first graduate of emergency medicine residency program in Saudi was in somewhere in 98. And when you think about it now, where we are now, the chances that you will be seen by a trained emergency physician outside the big cities and in many of even the community hospitals in the big cities is very, very little. So if you're living outside of the big cities or you happen to be there, the chances that you may lose your life because you were not provided with the appropriate care in the emergency department is very, very high. Furthermore, what we know now is in Saudi Arabia, there's a car accident every minute, and there's a death every hour, all right? And the number of strokes, the number of head injuries, the number of acute coronary syndrome is on the rise, and all those patients come through the emergency department. In many hospitals, the 80% of the admissions come through the emergency department. Tertiary care, it is at least 50%. Here at KFMC, it's around 60%. So how can we develop emergency medicine at the national level? You know, at time where we have a large country, we have more than 250 hospitals, we only have 150 board-certified emergency physicians, and today we need 3,000 and another 1,500 in the next 5 years, because Ministry of Health is building another 150 hospitals worldwide, nationwide in the next 3 to 5 years. So I think if we keep doing the same thing, just like, you know, what Einstein said, it's going to be insane to think that just, you know, relying on the residency program and at what graduates in improving, you know, quality of care in the emergency department is basically not gonna work, all right? So this is what's behind this idea, is to come with a realistic approach, you know, to the nation's problem in improving, you know, the quality of care in the community hospitals around the country. And we came with a vision of having all Ministry of Health emergency departments provide standardized high-quality care that is timely and evidence-based. Our mission was to facilitate the development of Ministry of Health emergency departments through enhancing the knowledge and skills acquisition of emergency medicine care providers, enhancing and streamlining the processes to provide safe, timely, patient-centered and evidence-based care, to establish standards for ED management, workforce development, patient care delivery, you know, facility design, and resource management. So this is the birth certificate of the EDP, and it was the main meeting we had of all the stakeholders, and that was in January of 2012, where we put together the oversight committee chaired by the Director General of Riyadh Health, and with membership that included our CEO, King Fahd at King Fahd Medical City, and some of the leaders in emergency medicine. And we also put together an execution arm, or an executive committee, which I chair, and we've invited all the chairmen of the big emergency departments in town to be members in this. And this is and all of them were very excited. And what we currently have is all the chairmen of the emergency departments in Riyadh taking a role in this initiative. We put together a strategic plan, and we realized that there has to be some quick wins to solve some of the really pressing problems. So we divided our goals into short-term, intermediate-term, and long-term goals, being 1 year, 3 years, and 5 years. In the short-term goal, what we did is we identified the top 10 pathologies that we need to focus on, and everything that we have done, was around those 10. So stroke, head injury, multiple trauma, chest pain, asthma, sepsis, poisoning, maltreatment, and strokes. And we had everything going around that. So what we did is we came up with a number of initiatives. The first initiative was the Advanced Emergency Course for Physicians. We invite, and we actually sponsor, emergency physicians in the community to come for a 3-day course here at KFMC, plus a 1-month rotation in one of the academic emergency departments in town, whether this be here or the University Hospital, King Faisal Specialist Hospital, or King Saud Medical City, or the National Guard, or the security forces. And we've completed so far 6 batches, and that's 120 emergency physicians that have gone through this course. We've did a similar course for the nurses, and we aim to have 10 courses within the 12-month period. We've finished already 3 courses of a group of 50 nurses, and they still, the same, they spend 1 month here. We managed to get funding, which I forgot to tell you, through the Ministry of Finance, and we have a very nice fund. So all those physicians and nurses that come from outside town, we provide them with housing, we provide them with meals and all that. So they spend nothing, all right, and they spend 1 month, all right, and then go back to their hospitals. And the third initiative was assigning a facilitator who's an emergency physician consultant for every large community ED. And here's a picture of myself with 3 emergency physicians from Al-Kharj. And we have Dr. Majid here, who is the director of the King Khalid Hospital at Al-Kharj. So I basically go and visit with them twice a month. And my other 9 colleagues who are emergency consultants, each one of them is assigned to one of 10 big hospitals in the community. Most of them are outside Riyadh. And basically, we facilitate all the work we're doing around standardization of care for those 10 illnesses I told you about, plus providing advice on standards in manpower, design, equipment, etc. The fourth initiative, which is coming very soon, is to have an emergency medicine leadership program, and we're hoping that we'll have our first one early next year. We worked on providing clinical guidelines, care pathways, and order sets for those 10 illnesses I told you about. And we established an emergency department website where all those physicians could have all the resources on our website. And then we established a medical consulting service through phone. So every week, 24/7, there's a pediatric emergency consultant on duty and an adult emergency consultant on duty. And we receive calls from all over Riyadh region. And we've made an arrangement with the director of health affairs here that all the life and limb threatening referrals that come from the community to the big hospitals have to be approved by the on-call. And this, the main reason is to just capture the golden hour where we can make sure that the care, appropriate care has been provided to those patients. We're working on providing electronic access to medical references in every ED. And then working on evaluating the current ED facilities, and this is what the facilitators do. They go and do an assessment, assess the current ED facilities, equipment, and provide consultations in the designing, equipping, and staffing the new facilities. And aiming really to have a community ED model, all right, that can be replicated throughout the kingdom. Now, I'm going to finish here with this big question is what's next? Currently, we're only working in the Riyadh region, all right, and we're doing all this. The number one thing, and I was actually, you know, I was speaking with Dr. Mate last night about our project, and he said, well, how are you evaluating the impact of what you're doing? And I think this is really a big question, and which we did realize from the beginning, but we faced a major difficulty in the lack of data, all right? To do it, we have to do it the old way of having, you know, data collectors and, you know, doing a chart review on what was the situation before our involvement. But basically, I think this is what we're going to do, at least, you know, in some of the EDs to get the right sample size of doing a pre and a post assessment of our interventions. We're going to approve and publish the emergency medicine standards, a manual that would have all the standards for any Saudi emergency department. Next year, in a month or two, we're going to expand to Al Qasim area, which is just, you know, the region next to Riyadh. So that's another at least 13 or 15 hospitals. And then we'll move every year to, you know, one region at a time to cover the whole kingdom. That will make it more difficult, but more exciting and more useful to the community. So those are the short-term interventions. In the intermediate term, we're working on having a 2-year emergency medicine diploma. You know, what happens is that the Saudi residency program in emergency medicine is a highly competitive, and it only takes Saudis, while more than 90% of emergency physicians in the community are non-Saudis, and they have no opportunity for training here in Saudi Arabia. So what we wanted to do is a kind of a middle solution of having a 2-year diploma for all those, you know, for all this workforce to at least, you know, learn the principles of emergency medicine and be able to provide appropriate care in the community. On the long run, of course, we want all those standards to cover the whole kingdom. We're hoping that we will expand the number of annual intakes in the residency program to be able to provide certified emergency physician in every emergency department. Thank you very much.